Thanks so much, Tawana. Well, it's Tuesday, which means we are continuing to talk to Greenwood LaFleur Hospital. And in the last few weeks, we've been talking about sleep apnea and the dangers of breathing while you're sleeping at night. This morning, we're joined with Dr. Rodney Brubaker. He's of Greenwood ENT and Allergy. And you have a different perspective on a lot of this, and we really want to get your perspective this morning. So welcome and glad you're here this morning.
Well, thanks for having me.
Hey, let me ask, I have a specific question for us this morning, but you know, when we talk about sleep apnea and we talk about kids who have breathing issues, what do enlarged tonsils and adenoids have to do with when it comes to a child and breathing issues?
Well, to a large degree, the problems with adults and the problems with children are different. I mean, children obviously are small, and proportionally they have larger tonsils and adenoids occupying the space and place that we would normally want to move airflow through. So when they're enlarged, it compromises the ability for kids to breathe well, and when you sleep at night and you relax, you further collapse, and then you end up sometimes with sleep disordered breathing. So large tonsils, large adenoids can mean nasal airway obstruction, can mean upper airway obstruction, especially at night when you're trying to sleep, which adversely affects your quality of life.
Absolutely. And when we talk about tonsils, I think most people know what a tonsil is. Talk about what an adenoid is. What is that and how does that affect folks?
Well, tonsil tissue and adenoid tissue is just part of our lymphoid system, and we know we've got our glands throughout the body. We've got 4,000 lymph nodes. We have a spleen, bone marrow, etc. It's all part of the lymph system, but the tonsils and the adenoids tend to be bacterial reservoirs, and they tend to be enlarged in childhood, therefore the problem.
If parents are at home and they're watching, one thing that we've talked about the last few weeks is obviously different factors affect, how somebody at night sleeps and not breathing. If you're an adult, you're overweight, these are issues.
Sure.
What are some issues that children might face that might be some key factors to say, hey, this might be a reason, and with that tonsil and adenoid, what should they be doing about it?
Well, there's important things to realize. I mean, yes, an overweight child can be relatively the same as an overweight adult. Obesity and being overweight adversely affects your sleep quality often. But in young children, you can be just thin as a rail and still have very large tonsils and adenoids, and when you go to sleep, you compromise your ability to sleep well. Your sleep is interrupted, and kids and adults have a different scale, and this is why I think it's important to realize that it takes sometimes a clinical practitioner, 10, 15, 20 years in order to understand all the various permutations of these problems. And hence when you get a good feel for that, you realize that just because tonsils are big or adenoids are big, that's not always bad.
Right.
But what is important is when you take into consideration and ask all the right questions, you can pre-select out the ideal individuals that will significantly benefit from adenoidectomy and result in nasal airway improvement, or tonsillectomy, or the two together, and that will significantly improve the child's sleeping patterns, learning abilities, quality of life issues, etc.
Now, if some parents out there are interested, say, well, maybe just like you said, my child does have enlarged tonsils or enlarged adenoids, what should they be doing if those are concerns for them?
Well, if your child is tired in the morning, if you notice that your child has some stoppages of breathing or snores loudly and excessively to the point where you can hear them from the other room, those are all harbingers. Those are all indications that there may be a problem. So bottom line is, safe is always better than sorry. And if you sense that something's not right, your child's not breathing well through the nose, seems to not be sleeping well, bring them in. Let us ask the right questions. We'll evaluate, and we'll go from there. Because like I said, big is all. Just because you come to my office doesn't mean you're going to get a tonsillectomy or adenoidectomy.
Right.
But if your responses are indicative that you need such a procedure, then I'll present the options and you get to make the decision.
I loved what you just said a minute ago. When you come to the doctor has specific questions to ask that we may not be asking, and getting that response from the child. So that's fantastic. Dr. Brubaker, thanks so much for informing us this morning.
Thank you for having me.
That's our medical moment right here with Greenwood LaFleur Hospital. We'll be speaking with them again next week, but stay with us. Coming up after the break, we've got more right here on Good Morning Mississippi.
This Health Matters segment is brought to you by Greenwood LaFleur Hospital.